Hello and welcome to my channel Pharmacology and Facts for Nurses. My name is Judith Olsens Apio and we are going to have a review about digoxin. And in this review, our focus areas are going to be on the classification of digoxin, how it works, and then we are also going to look at the clinical indications, the adverse effects and toxic effects of digoxin, interactions, and then what our nursing considerations and client teaching will be. So pick up your notebooks and pens and let us begin. Digoxin is classified as a cardiac glycoside. Cardiac glycosides are substances that are produced by certain plants that have the effect of increasing contractility of the heart muscle. And such plants are, for example, the digitalis plants like the purple foxglove and then the white foxglove. Because of where they are isolated from, we also usually refer to digoxin or to cardiac glycosides as digitalis glycosides. So what exactly are the actions of digoxin that makes it a valuable drug in clinical practice? So one thing for us to note is that digoxin produces a number of effects in the heart and it makes it a good drug for managing a number of heart conditions, as we shall see. But first effect that digoxin is going to produce is an inotropic effect. Inotropy is a word that describes the contraction of the heart muscle. We usually describe it either whether we are having an increased contraction or a reduced contraction of the heart. So if you're having an increased contraction, you're going to say there is a positive inotropic effect, and then there will be a negative inotropic effect if there is a reduced contractility. Then we also have chronotropy, which describes how fast the heart is beating. So the heart rate. We can have a negative chronotropic effect or a positive chronotropic effect, depending on what's happening to the heart. And then dromotropy is to do with the conduction velocity of electrical impulses from the sinoatrial node to the left ventricle. Now, when we have a negative dromotropic effect, we are having a reduction in conduction velocity. A positive dromotropic effect would be an increase in conduction velocity. Now, digoxin produces a positive inotropic effect. It is going to increase the contractility of the heart, and that helps to push blood forward. However, as it is increasing the force of contraction of the heart, it is going to reduce the rate at which the heart is going to beat. So it produces a negative chronotropic effect. And then also it slows down the speed at which electrical impulses are moving from the atria to the ventricles. That's a negative dromotropic effect. And so we are going to see how exactly that happens now. The mechanism of action of digoxin is described really according to what effects digoxin produces. So for the positive inotropic effects, digoxin is going to inhibit the sodium potassium ATPase pump. This pump is an enzyme, and this enzyme naturally or ordinarily is what pumps sodium out of the cell and keeps potassium inside of the cell. So we would think about it in this way. You have this is outside of your cell and this is the inside of your cell. So the sodium potassium ATPase is going to push potassium inside the cell and then drive sodium out of the cell. Digoxin is going to block that pump, and if it blocks the pump, it means that we are going to have more sodium inside the cell, and then potassium would get out of the cell because it's going to inhibit that exchange pump. And when we have an increased amount of sodium inside the cell, what is going to happen? Calcium levels are also going to increase in the cell from its storage sites. calcium is going to be released from its storage site. Its concentration is also going to increase inside the cell, and it is going to be responsible for the increase in force of contraction, hence the positive inotropic effect. Digoxin produces a negative chronotropic and a negative dromotropic effect. How does it do that? So we look at a rough structure of the heart, and we look at how electrical impulses are generated and then propagated across the heart. So usually electrical impulses are going to be generated from the sinoatrial node, the pacemaker, and then this impulse will flow downwards to the ventricles and also, of course, to the other atrium. And then, okay, so here we have the sinoatrial node, and then you have the atrioventricular node, the node between the atria and the ventricles, which kind of slows down the impulses that are coming here, such that the ventricles have time to fill up with blood before they can contract. So from the sinoatrial node to the atrioventricular node, these impulses are going to form a bundle of his, which bundle branches into the right bundle and then the left bundle, which once it reaches this part of the ventricles, it's going to start giving out projections, which are the Purkinje fibers, to supply that whole part of the ventricles. Now, what does digoxin do? Digoxin is going to inhibit the sinoatrial node. It's going to slow down the velocity or the speed with which electrical impulses are being generated and passed on from the sinoatrial node to the atrioventricular node. And that in essence is going to slow down the conduction velocity, which also has a resultant effect of really slowing down the rate at which the heart is going to beat. In fact, here at the sinoatrial node, we also do have muscarinic type 2 receptors. These are parasympathetic receptors. So we have M2 receptors that are located in the sinoatrial node, and usually when these M2 receptors bind with acetylcholine, it's going to cause a negative chronotropic effect. Digoxin actually produces, or it's going to stimulate the vagus nerve, and the vagus nerve supplies the sinoatrial node. So through the M2 receptors, digoxin is going to produce a vagal effect, and that vagal effect is also going to slow down the impulses from the sinoatrial node, of course, down from the atria to the ventricles, and then you shall end up with a negative chronotropic effect. So those are the ways in which digoxin works. And because of that, what is going to happen is you are having an increased squeezing of the heart, or an increasing force of contraction of the heart, with a reduced rate with which the heart is beating. What does it do? It gives time for the ventricles to fill up with blood, and then for the ventricles to squeeze or to contract and push blood to the rest of the body. After we have looked at, the mechanisms, the various mechanisms of action of digoxin in producing the different effects that it is associated with, let's then talk about why that is good. Why is it a beneficial effect for digoxin to have a positive inotropic effect and yet a negative chrono and dromotropic effect? Now, for the heart to be able to push blood forward and adequate blood, it also needs to fill up with enough blood, okay? And if the heart is pumping very fast, it doesn't get enough time to fill up with blood. So what does digoxin do? Digoxin is going to say, okay, let the heart pump harder, but let me slow it down, because in slowing it down, I'm going to give it time to fill up with blood so that when it pumps, we're going to push out an adequate stroke volume, which eventually at the end of the day would relate to an adequate cardiac output. So reducing the speed with which the heart is pumping while increasing the force with which it is pumping increases the efficiency of the heart, and that's the good thing about digoxin. Now, because we will have improved our cardiac output, we are going to have the critical organs receiving enough blood, and especially, for example, the kidneys are going to be better perfused. And if they're better perfused, we are going to have increased diuresis. And when you have an increased diuresis, if, for example, we see a client with heart failure, especially with congestive heart failure, who usually might be having congestion within the lungs and a peripheral congestion, we are going to see a relief in the swelling. We are going to see that the lung sounds are going to get are going to get clearer. The patient is going to tolerate exertion better. They're not going to have that increase in difficulty in breathing. In other words, the symptoms of heart failure are going to reduce. But that really brings us to the clinical uses of digoxin. So, like we have already said, one of the clinical use is in heart failure because digoxin is going to increase the force of contraction of the heart and therefore increase a cardiac output. In fact, if we were to be very precise and specific, we would say digoxin is used in systolic heart failure. And in heart failure, once we use digoxin, because we are going to have an increase in perfusion of the kidneys and therefore losing the excess fluid that was held up in the body, we are going to have an improvement in the signs and symptoms of heart failure. Then, because of the reduction in the conduction velocity from the sinoatrial node to the atrioventricular node, we can use digoxin in atrial dysrhythmias, for example, in atrial flutter and in atrial fibrillation. And then we also do use digoxin in managing cardiogenic shock. In cardiogenic shock, the body is receiving very little blood because the heart is not able to pump harder to provide a cardiac output. So digoxin can also help to stimulate the heart to beat faster. Let's look at the adverse effects and the toxic effects of digoxin. Now, usually for the nurses who are sitting for the NCLEX, when you're asked about the adverse effects of digoxin, sometimes the NCLEX lady is going to demarcate and then ask you, for example, what would the early signs of digoxin toxicity be or digoxin adverse effects, and what would the later signs be? So, the adverse effects of digoxin are seen with increasing amount of digoxin in blood. Okay, with increasing amount of digoxin in blood. So as the levels of digoxin start to rise above 2 nanograms per mil, because the therapeutic level of digoxin is 0.5 to 2 nanograms per mil of blood. So if digoxin levels start to go beyond 2, we are going to start seeing, or the patient is going to start experiencing certain effects. And those earlier effects are going to be mainly GI disturbances, for example, nausea, vomiting, anorexia. Some patients may even report diarrhea. In pediatric patients, you might see them vomiting. Okay, then you're also going to notice that the clients complains about fatigue. They may complain about visual disturbances. They see certain sights. For example, we describe one as being seeing halos or yellow halos, like dancing light sensations. Then a yellow-green tinge. The vision may be blurred. Then, as the levels continue to rise way above 2, we might end up with dysrhythmias. And these are really the most serious toxic effects of digoxin. And here we might end up with an extreme sinus bradycardia, but also we might see a rapid response by the ventricles. So we could also end up with a ventricular arrhythmias, especially the tachycardic form of ventricular arrhythmias. Please remember, you might be asked what a late adverse effect is, which would be really dysrhythmias, and then what the early signs are. The early signs are mainly the GI disturbances. Let's talk about the toxicity of digoxin. Digoxin effects occur when the blood levels, the therapeutic levels of digoxin go beyond 2 nanograms per mil. Okay, like we said, This is our normal or a therapeutic level. When we give a client digoxin, the drug needs to be within this level for us to appreciate its therapeutic effects. So if it's below zero point 0.5, we might not achieve much. If it's above 2, we might again start getting effects that we do not intend to produce. So toxicities are going to be seen when we have greater than 2 nanograms per mil of blood of digoxin. Okay, and these toxic effects are worse, especially if somebody has electrolyte imbalances. For example, if we have hypokalemia, the arrhythmic toxic effects of digoxin are going to be more pronounced. The same thing with hypomagnesemia and hypercalcemia. Hypomagnesemia and hypercalcemia have the effect of actually potentiating the calcium effects. So we are going to have higher amounts of calcium going to predispose to the dysrhythmic toxic effects. So note here we have hypokalemia, hypomagnesemia, and then hypercalcemia. Imagine in the mechanism of action of digoxin when we saw that we are going to have an increase in calcium levels within the cell that is going to increase the force of contraction. So if you're having an exaggerated amount of calcium in there, we might end up overstimulating the heart. So another risk for toxicity of digoxin would be seen, for example, in the elderly because their excretory organs are now slowing down in terms of function. The glomerular filtration rate has reduced. The liver might not be working as well as it used to do. Then also in the neonates, because those organs, the liver and the kidneys, are not yet mature to eliminate these medications as fast as we would like them to do. Another risk for toxicity would be if a client has a renal insufficiency. I mean, if the kidney is not working well, then digoxin is going to accumulate in the body and produce those toxic effects that we saw. So what then are the administration considerations for digoxin? Now, the first one, for NCLEX, you need to remember this. Don't forget this. Because digoxin produces a negative chronotropic effect, it's going to reduce the heart rate. We want to take the apical pulse for 1 full minute. The apical pulse is the one that you take from here at the fifth intercostal space, mid-clavicular line, okay, mid-clavicular line at the point of maximum impulse. So count the pulse for 1 full minute. Of course, you will be using the stethoscope for 1 full minute. Now, if the pulse is normal, between 60 to 100 beats per minute, you're going to give your medication. However, if the pulse is less than 60 beats per minute in adults, that's a bradycardia, or less than 70 beats per minute in children, we are going to withhold the digoxin and notify the primary healthcare provider or notify the prescriber or the doctor. And this pulse has to be taken before we get another dose of digoxin because we don't want to end up with a profound bradycardia. And then another thing that we also need to do is to periodically monitor digoxin levels. Now, it doesn't mean that we are going to monitor these levels all the time because as we give the medication to the patient, we are going to reach a steady state concentration. And at that level, don't expect there to be, spikes in concentration and also differences in effect. So with that, we might not monitor all the time. But a key point for NCLEX is that we need to monitor digoxin levels. Digoxin is a drug with a narrow therapeutic window or a narrow therapeutic index. Therapeutic window is that space or the interval between the therapeutic dose of the drug and the toxic dose of the drug. Now, when you look at the one for digoxin, like you've seen here, 0.5 to 2, this window is quite small, meaning we can easily slip into the toxic dose of the drug. So because of that, we want to do close monitoring of the digoxin levels, and anything above 2 nanograms per ml. We are again going to withhold. Okay, we shall withhold and then we notify. Okay, and then of course we need to exercise caution when we are giving these drugs to the elderly and the neonates. In fact, among this population, you want to monitor for adverse and toxic effects closely. Then in terms of our teaching, we are going to teach the patients about the signs and symptoms of toxicity so that once they identify, they are able to report in a timely manner. Also, teach the patients to keep their appointments because then we will need to do the blood level of the drugs and they need to come back in hospital for us to be able to do that. Teach them to measure their heart rates. Now, while as nurses we measure the apical pulse, for clients, you're going to teach them to measure the radial pulse, okay? You're going to teach them to count the radial pulse again for a full minute and give them the cutoffs of the pulse rate for when they should report. Anything below 60 beats per minute in adults to 70 beats per minute in children. So we are going to teach the patients about potassium supplementation. This is very important. We teach the patients about foods that are rich in potassium. And usually in client teaching, you don't just tell them, eat foods that are rich in potassium. They don't know that. You actually mention common examples of those foods that are rich in potassium. And there is a number, as you can see them, listed here. The case where the patient is showing serious toxic effects, the antidote for digoxin is an antibody that is called digoxin immune fab. You may find it being called digibind, but remember in NCLEX you want to use the generic names of drugs. So digoxin immune fab, because it's an antibody, it's going to detect digoxin and take it as an antigen, and then it will bind that and form an antigen antibody complex, therefore rendering that digoxin molecule ineffective. It is not in all clients who are experiencing toxic effects of digoxin that we give digoxin immune fab. There are indicators for when we can use the antidote. First of all is when we have a life-threatening overdose or a life-threatening blood level of digoxin beyond 10 nanograms per ml, when we have life-threatening dysrhythmias or life-threatening hyperkalemia, then that's when you will use digoxin immune fab. However, you may also be asking the NCLEX what steps you would take if a client was showing toxic effects of digoxin, especially the serious effects of digoxin. Of course, the first thing you're going to do is to withhold the medication, stop the medication, and then you're going to connect the patient to a continuous EKG monitoring, while at the same time, if there are any antidysrhythmic drugs that have been prescribed, you're also going to put the patient on those antidysrhythmic drugs. Then another thing that you're going to do is to provide potassium supplementation for these clients, and then you're going to monitor the digoxin levels, and then also offer supportive care, and then especially supportive care of the GIT, you know, the nausea, the vomiting, and the diarrhea. Lastly is when we give the digoxin immune fab. What are the significant drug-to-drug interactions that can occur when a client is taking digoxin? So some of the common drug-to-drug interactions that you need to know for your NCLEX especially are these. Now, the first interaction occurs between digoxin and loop and thiazide diuretics. Loop and thiazide diuretics are potassium wasting diuretics, and digoxin toxicity is usually very common in the picture where we are having a hypokalemia. So if a client is receiving either a loop or a thiazide diuretic and as well they are receiving digoxin, we need to monitor the potassium levels of that client closely. Another interaction occurs with the angiotensin receptor blockers, ACE inhibitors, potassium sparing diuretics, and potassium supplements. And here They're going to increase potassium levels, hyperkalemia. If you recall the mechanism of action of digoxin, when we block the sodium potassium ATPase, we're going to hold more potassium in the extracellular space. So if you give digoxin while at the same time also giving drugs that elevate levels of potassium, we are going to end up with a bad hyperkalemia. Digoxin produces a negative chronotropic effect, that's increasing the heart rate. So if we give it concurrently with other drugs that also have negative chronotropic effects, for example, the beta blockers and the calcium channel blockers, we are going to end up with an additive bradycardia. When you give digoxin together with antacids, sucralfates, with the bile acid sequestrants, they are going to interfere with the absorption of digoxin. So we will really not utilize it that much. And then also it might interact with other antidysrhythmic drugs, for example, amiodarone, procainamide, and that can also predispose us to more dysrhythmias. Thank you for following and watching this review on digoxin. I hope that it has been helpful to you. I'd like to thank all those who have subscribed to my channel. Today we have over 100 people or over 100 subscribers. Please keep those subscriptions coming in. If it's your first time today, please subscribe to my channel, like this video, and share with your friends. Also, post your comments and suggest what you think you might want us to talk about. I have linked up all the videos that we have on this channel. Please take your time to watch them and then increase your knowledge about farm and increase your chances of passing the NCLEX. Thank you.